Welcome to week 4, where I am talking about what integrative psychiatry is and how it's different from regular psychiatry. Here is a story I have seen a lot. A woman whose antidepressant was working, her mood had improved, she was functioning better. Her therapist noticed, her family noticed it, but something was still off. She was exhausted, not in that leaden feeling of depression, but in a physical fatigue that kind of followed her through the day, even though she was sleeping enough. And she was getting in daily movement, she was paying attention to her nutrition, she was doing everything right, but she was still dragging. So we ran a comprehensive lab panel and found that her vitamin B12 and vitamin D levels were both borderline low. So they weren't flagged as deficient by the standard reference range, but they were low enough to matter. And so we started some targeted supplementation. And within 2 to 3 months, her energy had really shifted and improved noticeably. And she felt like herself again. So the antidepressant hadn't changed, but what had changed was addressing the whole picture. And here's another example. I saw a woman who had been doing well on her medication for over a year. She was stable, functioning, feeling good. And after we dug into what was going on, she told me that she hadn't been feeling as well, but had started experiencing some pain that kept her from her daily running routine. So she noticed her mood had started to slip. It wasn't dramatic, but it was definitely noticeable, and she came in wondering whether she needed a higher dose of her medication. After a careful evaluation, it was clear that her medication hadn't stopped working. What had stopped was the thing that had been supporting everything else together alongside it. So we didn't end up increasing her dose. Instead, we worked out a plan to address the pain and get her returning to movement. Within a few weeks of getting back to movement and getting back to running, she was back to baseline, and her prescription that day wasn't a medication adjustment, it was a plan to get her back to running. Both of these stories illustrate something important. When you treat the whole person, you have more tools, and more tools means more ways to help, and that's integrative psychiatry. So what is it exactly? Integrative psychiatry blends conventional psychiatric treatment, medication, and psychotherapy when indicated with evidence-based, complementary, and holistic approaches that are tailored to the individual. The key word here is that it blends these things. It isn't about replacing medication with supplements or choosing natural over traditional. It's about having a wider toolkit and matching the right tools to the right person. Where conventional psychiatry often focuses primarily on diagnosis and medication management, integrative psychiatry asks a broader set of questions. What is driving this person's symptoms? What else might be contributing? And what does this person's full picture, their sleep, nutrition, their movement, their stress load, their support system, their lab values, their hormones actually look like? A medication can do a lot, but it cannot take things off your plate. It can't replace sleep. It cannot substitute for movement or connection. And integrative psychiatry addresses all of it. This approach is also deeply individualized. There is no one-size-fits-all protocol, and what works for one person may not be the right fit for another, which is why a thorough evaluation always comes first. So how is integrative psychiatry different from regular psychiatry? In a standard psychiatric appointment, particularly in a busy insurance-based outpatient setting, a medication management visit is often 15 minutes. There's time to assess symptoms, adjust a prescription, and not much else. And that model has real value for many people, but it leaves a lot on the table. It rarely includes a conversation about what you're eating, whether you're moving your body, what your sleep looks like in detail, and what your vitamin and hormone levels are, or what your stress load actually consists of. So often, because of time constraints, these considerations are frequently left out of a standard psychiatric evaluation, but they can have a profound effect on mental health. An integrative evaluation takes more time, asks more questions, and considers more variables. So the goal isn't to find one single answer, it's to build a complete picture so that treatment can actually match the problem. It also means that your treatment plan may include things that a conventional appointment wouldn't prescribe. A specific supplement, maybe a recommendation about light exposure, maybe a referral to acupuncture, a conversation about whether hormone therapy belongs in the picture. And all of it is grounded in evidence and all of it is tailored to you individually. Now, I also want to be clear, this is not anti-prescription psychiatry. Psychiatric medications can be life-changing and life-saving in many cases, and they often move the needle and move it faster more than many other tools. But medication is also often not the full picture, and this is where the integrative approach comes in. Let's go through 8 areas that integrative psychiatry considers. Number 1, comprehensive lab screening. It is not necessarily standard to order blood work in a typical psychiatric evaluation. An integrative approach, though, often does, and it goes further than a basic panel. We are looking at things like vitamin D, vitamin B12, iron stores, magnesium, thyroid function, glucose metabolism, and in the right clinical context, hormone levels, and other things. Deficiencies and imbalances in any of these can drive or worsen mood. They can also worsen anxiety, fatigue, sleep problems, and cognitive symptoms, and they are treatable once they're identified. Number 2, movement and exercise. Exercise is one of the most evidence-backed interventions we have for mental health, and it is chronically underutilized. Research has shown that regular movement can be as effective as medication for mild to moderate depression and anxiety. Yoga, for example, has been repeatedly shown to reduce anxiety and improve mood. Strength training is particularly important for women in midlife. Not only does it support muscle mass and bone density, but it also has significant mental health benefits. This doesn't mean everyone needs to run a marathon. It just means finding consistent, sustainable movement and treating it as a clinical priority, not a luxury. Number 3, nutrition and targeted supplementation. What we eat directly affects brain chemistry. There is a strong gut-brain connection that is well established. For one thing, the gut produces a significant portion of the body's serotonin, more even than in the brain. And an integrative approach considers nutrition as part of the clinical picture and uses targeted supplementation where the evidence supports it. Things like fiber, omega-3 fatty acids, magnesium, vitamin D, and others. We'll go deeper on specific supplements and nutrition in a later episode. Number 4 is sleep. This one is huge. Sleep is not a lifestyle factor or just a luxury. It is a biological necessity, and disrupted sleep is both a symptom of and a contributor to virtually every psychiatric disorder. An integrative approach takes sleep seriously, evaluating its quality and structure in detail and not just asking, are you sleeping okay? Number 5, light, connection, and lifestyle. Research consistently shows that light exposure, particularly morning sunlight, plays a meaningful role in mood regulation and circadian rhythm. Social connection is not a luxury. It is a documented protective factor for mental health. And lifestyle load matters. If there is too much on your plate, a medication adjustment isn't going to change that. Part of an integrative evaluation is being honest about what the external environment is actually asking of you. Taking a walk outside in the morning with a friend can target all of these areas beautifully and make a meaningful difference. Number 6, mind-body practices. Here I'm talking mostly about yoga and acupuncture, although that's not a full list. Yoga's benefits for anxiety and mood are well supported in the research. Acupuncture, which is often dismissed as alternative, has a meaningful evidence base for anxiety, pain, and nervous system regulation. It works in part by supporting parasympathetic tone, helping the body's rest and digest system stay online, and that counteracts the chronic fight or flight state that often underlies so much anxiety and sometimes depression. Number 7, hormone considerations. For women in perimenopause or the menopause transition, menopausal hormone therapy may be a really meaningful part of the treatment picture. not just for physical symptoms like hot flashes, but for mood, sleep, and cognitive clarity. This is a really nuanced conversation that deserves individualized evaluation, and it's one that integrative reproductive psychiatry is well positioned to have. Much more on this next week in week 5. And finally, number 8, nutraceuticals and botanicals. Several natural compounds have genuine evidence behind them to support mood, sleep, and anxiety treatment. For example, magnesium glycinate can be helpful for sleep and anxiety. Omega-3 fatty acids are helpful for mood and attention. Vitamin D can be helpful for both. Even something like oral lavender can be helpful for anxiety and sleep. And these are just a few examples. It's important to note that these are not necessarily replacements for medication when medication is indicated, but they are real tools and in the right context, really meaningful and helpful ones. Future episodes will go into much more on this later. So what does this mean for you? If you feel like you've been doing the right things, taking your medication, going to therapy, and you still don't quite feel like yourself, it doesn't mean that treatment doesn't work. It just may mean that the full picture hasn't been assessed yet. If you've been hesitant about medication and wondered whether there were other options to try first or alongside it, there often are, and they deserve a real clinical conversation. Integrative psychiatry is not a rejection of conventional medicine. It is an expansion of it. More questions, more tools, more ways to get you to a place where you genuinely feel well and thriving, not just managing and surviving. Next week, we're talking about perimenopause and depression, and more on why antidepressants alone sometimes fall short in midlife and what a more complete approach looks like. If you're in your 40s and feel like something has shifted that treatment isn't fully addressing, that one is for you. Subscribe so you don't miss it, and leave a comment if something in today's video resonated. I'll see you next week.